My name is Oriza Watanabe. I am one of the social work supervisors here at Jacobi. I am also the DV coordinator as well as the child protection coordinator. So we see maybe about 5 to 10 patients in a week, I would say, who comes to the hospital in relation to some sort of domestic violence. Sometimes patient will come in for their regular primary care visit or any other, subspecialty visit. And within the conversation with the doctor or with the nurses or even with the clerical staff when they're registering, topic of domestic violence may come up and they may disclose that they are, dealing with a situation of such. So maybe, when I say 5 to 10, that's primarily patients coming to Jacobi with injuries or any type of medical condition related to domestic violence. But I think people who are coming to the hospital having issues with domestic violence, the number is so much more higher, I think. So the most typical DV case would be a case that comes through the emergency department if somebody is, let's say, physically assaulted by their intimate partner and they end up coming to the emergency department. Obviously, their physical safety and physical well-being is our #1 priority, so the medical team will go in and do their assessment. Then most of the time, they will consult the social work department. In the emergency department, we have almost 24-hour coverage. So one of us will be called into the emergency department. We'll conduct an assessment with the patient. Obviously, privacy is a very important sort of topic that we make sure that we grant the patient. Emergency department can be very busy, but we want to make sure that the patient have adequate privacy when we discuss about their issues with domestic violence. We do safety planning. We obviously discuss about the resources available to them in New York City so that they can once they leave the hospital, they have access to safe housing, supportive services, mental health service, legal support if that's what they need, childcare, housing, any other supportive services that they require. I feel like a lot of the times people think call 911 is the best thing to do. I think it really depends on the case. Sometimes there are obvious reasons for survivors to not want to reach out to police or not want to leave that relationship. There could be multiple different factors that play in to making the decision to stay in that relationship, which is their decision to make, and we need to respect that. But I think one of the resources that we use the most is the Family Justice Center, which is located in each family court in each borough. It is sort of like a one-stop shop place for domestic violence services. There's multiple agencies that are located in one place within the family court. That's where we normally refer patients. Just because it's, it covers housing, it covers legal, it covers childcare, it covers a whole variety of services. So that's where we suggest people to be connected to.